I was going to say to those that are joining via Zoom, we've got a component in person, and then you guys joining by Zoom. So we'll give it a few minutes and see where we stand as it relates to quorum.
Just let me know when you kick off, so I'll start this recording.
All right. Well, I think we'll kick it off. So 6:04, I have Carol present at Remo. And we just reviewed the persons who have joined by Zoom and the persons who are attending here. And we do have a quorum, so congratulations. And we'll begin at, as I said, 6:04 p.m. Call the meeting to order. And we can do our Pledge of Allegiance.
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we don't necessarily need to approve the minutes from the previous meeting because it's a recording. So they're available if anybody ever needed to take a look at it. Excused from tonight's meeting, Dr. McHugh, Alan Bell, and Steve Kroll. Are you gonna, do you think we'll hear you from there? Or you want to come over here?
Can people hear me speak? Can people hear Tim talk?
Yes.
Excellent.
Okay. Executive Director's report, it's a short report tonight, starting off with just a reminder about vital signs. Kicks off tomorrow, Thursday. It runs through the 30th. One thing I think is a testament to the region here is if you look at the state winners that are going to be recognized at vital signs. Capital Region contributed 5 state winners this year. Edinburgh Emergency took Agency of the Year. Gene Tranca, EMS Educator of Excellence. Tom Lundquist from Saratoga, EMS Communications Specialist. Mike Broder, Albany College of Pharmacy, Excellence in EMS Quality and Safety. And the Albany County Sheriff's Accord program, which is basically a mobile crisis unit, took the New York State Innovation Award for clinical innovation. So Capital Region really kicked butt in the awards department this year. State contracts, I don't have any updates other than I've been notified they're in the review process. State told me to log into Grants Gateway and complete the signatory page, and I did that. So we're moving in the right direction with that. EMS vouchers, PJ, I wrote crickets because they still owe us a boatload of money there. We'll see when that check hits the door. And the only other thing, our new administrative assistant, Roxanne Mitchell, she's a SUNY Albany NPH student. She started her on the job training last week. So I think we're predicting probably a couple of weeks of on the job with Dave Galati, that we're going to turn the front desk over to her. And that concludes my report.
Does anyone have any questions for Tim? All right, seeing none, no specific chairperson's report, nothing specific under issue discussions. And that would bring us to operational reports. And Dr. Daly, if you want to do REMAC and academic possibly in Dr. McHugh's absence, that would be great.
I did not pull up a copy of the minutes from the REMAC and the academic. I apologize.
Not
so
a problem.
I don't have them to refer to right now. I will tell you that that from an operational perspective, we remain in in the same problems we all know about. Jay and his team sound like they're putting together some good thoughts in terms of how to approach hospital wall times from a operational EMS perspective. The hospitals remain in crisis. In particular, mental health remains a profound crisis. As we speak right now, Albany Med is on psych diversion. I'm going to turn this around in a slightly different direction, though, and let you know that I just went down to EMS Expo, ran into some Remo folks down there, which was great to be able to share new ideas and look at some of the research that's being done in other places. While it's a difficult operational time for EMS in terms of staffing and in terms of wall times and supply chain, I will tell you that I always come back from EMS Expo reinvigorated, looking at some of the great research that's being done out there, looking at some of the work that's being done to improve the care of our patients. And I'm excited for some of the next steps. There were some very, very interesting cutting edge things that were being shared down there. in terms of next steps towards cardiopulmonary resuscitation, survival, some new gadgets and gizmos that may prove to be useful, although the research is still out on them. Some great new video laryngoscopes that are on their way to the market, and just some great opportunities. So we're in a great business, taking care of patients, lots of new ideas, and lots of successful implementations across the country of things like blood transfusions in the field, some very aggressive telemedicine programs, field buprenorphine programs. So there's great stuff happening out there. So when you start getting frustrated about some of the things we face locally, recognize those frustrations are national and actually, frankly, worldwide. But there are still really great things that are moving this profession forward. We should focus on the good things and the way we're helping people, and keep on working together so that we can succeed for our patients. That's all I've got, Jim.
Excellent. Do you want to, just to go out of order, do you want to talk QI?
No,
I love it.
we have no report due to some of the turnover in the office and some of the changes. We've have not established a good forum there. That's something that Emily, Dave, and I will continue to be working on, so that we can establish a committee that has some good meaningful results for the group.
Excellent. Thank you very much. I'll just jump ahead and tell you that from a CON committee perspective, there are no items before the CON committee, so that's good for the committee members who didn't have to meet. And we'll go to PJ for treasurer's report.
I think it's okay with the chair here, we'll do the treasurer's report and the 22-23 operating and training budget.
Makes sense to me.
We should have, Tim sent out.
Sorry, but I can't hear a word that PJ is saying.
You can hear Tim across the, aisle, but you can't hear me sitting next to Jim. This is pretty good. Can you hear me now? Hello?
Yes, we can hear you now, PJ.
I
Okay,
can hear you. Can't get off
Okay.
mute, but I can hear you.
okay. Sounds good. All right, we did pass out the proposed 22-23 operating budget. Feel pretty confident in this budget. We put in the year-to-date numbers, which is actually the end of September numbers, the end of our year right next to it. And you can see we ended up in a very good position. We had total revenue of $55,778 over expenses. Now, if you take out the $40,000 that we put in an appropriated fund balance, we're still showing a $15,778 excess, which I have to tell you, I haven't seen that in several years. So hats off to Tim and the gang. They put in for a lot of COVID reimbursement expenses, which helped us out tremendously. The training program is coming together, and I think we are on the right track. The proposed 22-23 budget in there is, I feel very confident about this. We did raise the training funds up to $75,000. You'll note that our budget for 21-22 was $51,000, and had the state paid us for what's out there, we would have been up to 74,000. So I feel very confident in that projection of 75,000, which would give us a total income of 334,195. Now, somebody will ask a question, what's the ARMS revenue that we put in there? Again, the ARMS budget is unknown to us at this point in time. We do know what the budget is. We don't know when we're going to obtain those funds. Tim has reached out several times with no answer yet. Hopefully, we thought we would have had answers by tonight, but we don't. So again, out of $153,000 budget, I think that 10,500 we should be able to scrounge out of there at some point in time, hopefully. This budget also reflects a 5% increase, proposed salary increase for the administrative gang here. It has been years since they've had any kind of salary increase whatsoever. So that would be across the board. So again, projecting income and expenses will equal out. We should be in pretty good shape. Of particular note, you'll notice that our appropriated fund balance is down to $15,000. And if the ARM's budget does come to fruition, as we totally expect that it will be, we should not have to touch any fund balance whatsoever. So again, that's a crystal ball. We don't know exactly how that or when that's going to happen, although we feel pretty confident that hopefully in the next month or so, we should have some idea. Any questions?
I like it. I was gonna say, if nothing else, maybe we'll just hold till we get to that point in the meeting to actually vote on the budget. But it would be my belief, unless somebody wants to do it in a two-part segment, that the budget includes a component that addresses salaries and cost of living increase. So again, unless somebody feels the need to vote on those items separately, if we just vote on the budget and approve the budget, then we will also be approving that as well. So unless somebody has a question, that's how I'll be happy to proceed. Any questions for PJ?
Jim, I do have a question. With regard to the salary increases for the employees, we know in past years that the inflation has been less than 2%. Over the past year, we're in excess of 8%. So if you add that kind of all together, knowing that we haven't given significant increases to the staff in years, is 5% enough to remain competitive and to retain the employees that we need to retain to keep this organization as high quality as what it is? Are you guys comfortable with that?
Okay. Jim, what I actually talked over with Tim in regard to that was the unknown factor of the ARM's budget. What I would like to do is to proceed, and he was agreeable for his staff as well, proceed with that 5% for now. And obviously, when the ARM's budget falls into place and we know exactly what we're dealing with, we may need to revisit that at that point in time, which seems most logical, if that answers your question.
It does. I just want to make sure that we're appropriately compensating everyone for the work that they do and make sure that we retain the employees. You know how difficult it is to get quality employees at this point in time, you know, all over. So just want to make sure they're taken care of appropriately. So thank you.
Totally agreed. And we will review that once we know what's going on.
Okay.
Sounds good. DOH disciplinary actions, there were none. Course notifications, none. And those are, again, informational, so we're not actually approving those. Correspondence, we have a letter from Saratoga Hospital advising that Dr. Aaron Willen will be the new REMAC delegate for their facility. A letter from William Rockensteyer announcing his resignation from the Remsco due to other commitments as it relates to work. A letter from Dean Romano expressing his interest in the at-large or in an at-large seat on the Remsco. And then in addition to that, a communication that came in after Tim created the agenda is we also have a letter of interest that was sent in from Jeremiah Rod, who is a captain with the Scotia Fire Department, who has expressed his interest in serving as a representative to Remo. So I think, well, I'll just say it at this point, but anyways, so I had a conversation with Carol, and more than likely she and I will probably become part of the membership committee and revitalize some of the issues. Go ahead, Tim.
Jim, that resume from Mr. Rod showed up in my spam box just before the meeting tonight. So the people participating remotely don't have that. I'll send that out to everybody tomorrow.
Okay. And again, just I'm assuming you heard that. It's a little questionable as to what comes through, but Tim said he would forward that resume from the gentleman I just mentioned to everybody after this meeting. Committee reports. The executive committee did not meet. With Steve's absence, we would not have a finance or a New York State EMS council meeting. I don't see Anne Marie here in any capacity, so we'll assume we don't have a nurses committee meeting. PJ, anything for MCI?
Yes, Columbia County is going to be doing an active shooter drill on November 9th. And at that point in time, prior to that, we will be reaching out to the PSAPs to notify them to dust off their regional MCI plan, review it, because we will probably be contacting them at some point during the drill to see what agencies could possibly be available. Obviously, there'll be no transports, but we need to review the plan and make sure that the PSAPs are aware of it.
Very good. Membership, as I mentioned, is open. So certainly if anybody was interested in serving in that capacity, by all means, reach out. And if not, I said, Carol and I will probably take a look at that and see what we can do. Nominating, I don't believe we have anybody in attendance who could report on nominating. Probably not. More than likely the same for awards. Yes, no.
Yeah, there's no.
Oh, yeah,
report.
you wouldn't have, yeah, sure.
No report.
Yeah, and Carol's looking over my shoulders. I'm looking at the screen and not looking at Carol, who's sitting a seat away from me, but no report from awards. County reports, anybody from Albany County? Columbia County.
Nothing notable to report from Columbia.
All right, very good. That was Steve Meehan. I should announce that stuff since it's being recorded, but thank you. Greene County?
Nothing to report.
And that was by Steve Neer of Greene County, Rensselaer County. Yeah,
It's Ben Bornhorst. Can you hear me?
yes, we can.
Sorry, I have spotty cell coverage at best here, but Rensselaer County, we are dealing with a lot of the same staffing issues that everybody else is dealing with. We are having days that some of the stations that normally have paid crews are unable to complete crews because they don't have staff. And the feedback I'm getting from a lot of my agencies has to do with hospital turnaround times, specifically at the Albany hospitals. I know that they are in crisis and they're having issues with patient flow and getting them upstairs. But I'd personally like to see some sort of think tank come together that includes some pre-hospital people, because we have to come up. This isn't getting better anytime soon. And I think we need to come up with some solutions that will help with the flow. Some of them are very easy. You know, when we're bringing patients to the waiting room, we shouldn't be waiting in line like everybody else that's going to the waiting room. It should be a priority for someone to take report from us, someone for us to turn the patient over to, and for us to get back in service. Small things such as that, but I think we need to find a way to approach this where we can decrease our hospital turnaround times for these ambulances.
Ben, it's
That's
Dr.
what I-
Daly. I mean, I would suggest that you reach out to Tim offline. That's something that Jay Tyler from Gilderland and a bunch of other folks are already working on. I'm sure they'd welcome your involvement.
Reason, will do.
Very good. Saratoga County?
Nothing for Saratoga County.
Okay, and for the recording, that was Tracy Weir from Saratoga County, nothing to report. From Schenectady County,
No report, Jim.
and that's James Vina from Schenectady County. So the next item would be the approval of our 2022-2023 operating and training budgets. So unless someone has a question, I'll be happy to accept a motion to approve. All right, for those in attendance virtually, I have a motion by Steve Retzlaff, who's in attendance personally, to approve those budgets. Do I have a second?
I'll second, Jim.
I have a second by James Vina. Any question on that motion? All right, seeing none. And I realize this may be a little unusual, but seems to work. But is there anyone who would like to vote no? Anyone choosing to abstain? So for the benefit of those in attendance by Zoom and the people here in the office, that would account for a unanimous approval of the operating and training budgets for 22-23. Again, thanks to PJ and Tim and Dave for all the work that they put into that to make it happen. As already mentioned, and we'll just repeat it at this point, we do have open Remsco at large seats. One created by a vacancy when Scott Bowman was unable to continue to serve. And then the second one, as mentioned this evening, where Bill Rocketsteyer is unable to continue to serve. So we'll reach out to folks probably between this meeting and the next meeting, just to update you on where we're at and hopefully seek some candidates to fill those positions. The other thing that I'll just throw out, and we'll call it under old business, is obviously, as you know from previous meetings and the process that we've been working on for almost a year, is we have this approved process in place with ARMS, and the trigger to actually move forward is the retirement of their executive director. So we actually have a meeting scheduled for Wednesday of this week. So we hope to pin that down again, because it's easiest for us to have a process moving forward if we have a date in mind. And the process that we worked up until this point was with the anticipated retirement of this individual probably in the summer of this year timeframe. And obviously that didn't occur. So we're trying to get a better handle on that and be able to plan moving forward. With that, any items from the floor? Go ahead, Charles.
Yeah, this is Charles Welch with the Albany County Department of Health. I just wanted to inform folks that Albany County is working with the State Department of Office of Mental Health to take a hard look at suicide prevention. And with that, it reminded me that, this group a while ago was starting to take a hard look at, the stress level of EMS providers. And I was wondering if, we had a course of action to kind of advance that, either as in terms of training or presentations, or, whether we had any future plans to try and address that serious concern amongst our EMS providers.
Isn't there a state?
I don't have much, but Dr. Drew Anderson is pretty instrumental regionally. He's a SUNY prof, and he's done a lot of studies and research and continuing education along the same lines as this subject. But other than that, right now, I'm not aware of anything else. I don't know if Doc Daly is, but I'm not.
There are a whole bunch of different projects that are working in this space. So Charles, I think that's great. I think what we should do is just sort of look and see how some of these are starting to overlap on each other.
Sounds good. Any other items from the floor? All right, with that, our next meeting will be November 28th. I'm going to make the assumption that we'll probably be doing the same type of hybrid, virtual, and in-person to satisfy the public attendance component. And other than that, I'll accept the motion to adjourn. Got a motion to adjourn by PJ Keeler, seconded by Carol Brandt. All those in favor? I would assume everyone. All right. Thank you all for your attendance, and we'll see you next month.
Then you can hit end meeting. Or leave meeting or whatever it says.
I could be technologically challenged. How about if I just end it, will it stop? Because it still says it's recording. I'm trying to click on your icon. It's not really doing anything.
I assume so, but
Yeah, whatever. I'll let you look at it. That's what I do. It's like, yeah. At work, I
I'm
said,
just happy, not that we want this recorded, but if it's not the side of my head.
being recorded like we were last time. It seems like it's still doing it. Maybe I just didn't click it.